Okay, here is my station, my patient, and then I have my proctor.
That will include a CVL field.
So I would first verify the provider's orders, and then I'm going to check for any allergies. So I verified those orders and look for any allergies. That would make me need to use different supplies if they were allergic to anything I was using. So we're all good. And then I have already gathered all my supplies, and I am going to enter the patient's room. So I would enter, provide for privacy, and then I would perform hand hygiene, and then introduce myself to the patient. Hi, my name is Kylie. I'm a nursing student, and today I'm going to be changing your central venous line dressing. So before we get started, I'm going to go ahead and have you tell me your first and last name, your date of birth, and do you have any allergies? So the patient has identified themselves using two identifiers, and I've also checked the bracelet as they were telling me that, and those matched up. And then I've also reconfirmed that they don't have any allergies that would prohibit me from using any of my supplies today. So we're going to be changing your CVL dressing. So what that's going to look like is I'm going to lay you back. This is a sterile procedure, so I'm just going to ask that during the procedure you don't reach your hand up, you don't touch it. We just don't want to introduce any germs to the CVL site, okay? So I'm also going to give you a mask, again, just to make sure that we're not introducing any bacteria to the site. I will also be wearing a mask, and we'll do this as quickly as possible, okay? So I've explained the procedure to my patient, and I'm going to go ahead and raise the bed to my height.
Like I said, it will push your head to the left. And I'm going to be putting my mask on.
Okay. And then I'm laying the patient supine. So I'm going to lay them back just a little bit more. Good. Okay. And then I'm going to go ahead and give my patient a mask. So I'm going to give this to you, and we're just going to turn your head away, okay?
An extra mask.
We'll turn your head that way. From the side.
And I'll be putting my mask on.
And then we are going to look at the site.
Okay, and I'll be putting it down just for this video.
Okay, so I have this side exposed. I'm going to put my mask on.
I'm going to feel the patient's chest wall right in breakfast, and I do not feel any puffiness in the chest wall.
And then put on a pair of clean
Now
gloves.
I'm going to be taking the dressing change off, and I'm going to put my finger over the dressing support just to make sure it doesn't have any spots. And I'm feeling off, and I'm going to go.
So I'm first inspecting the site, making sure that everything is good, and then I'm going to feel for any crevices. Okay, so no crevices at the site, and then I'll go ahead and begin removing the transparent dressing.
There's no infection, there's no redness, there's no swelling, there's no drainage, there's no infiltrates, there's no inflammation, so everything looks good. Okay, so now I'm taking the dressing off, and I will dispose of this in a biohazard container. And so now I'm going to wash my hands, and I'm going to sterilely open the cat, and it will go away from me.
So then I would dispose of this into the appropriate biohazard container. So this is my container. Okay. So now I'm inspecting the site again, making sure not to touch it, and there are no signs of infection. There's no redness, no swelling, no drainage out of the site. So the site looks good. And then I'll go ahead and remove my gloves and begin prepping my sterile field.
I'll be placing them on another table. Okay, so I'm being careful to open up. My sterile gloves.
Okay, and then I don't need this mask, so I'm just going to throw that away. And then I'm going to put on my sterile gloves. Actually, before I do that, I'm going to open my BioPath and place it on the sterile field.
And with this, I'm going to open up to the biofield.
Okay, and that will also go in the trash. And now I'm going to put on my sterile gloves. And I would also wash my hands after I took off my gloves.
It's not opening, so. I'll get new sterile gloves at this point. Right now I'm going to put this in the biofield.
So I now have my sterile gloves on.
Okay, so with
And then I'm
these
going
new
to
sterile
prep my
gloves,
field.
just open the package. And do my sterile gloves. With these new sterile gloves, I'll be applying putting on my sterile.
And then I'm going to go ahead and open my transparent dressing since I will contaminate this field. Alright, so now I'm going to go ahead and contaminate my non-dominant hand. I am grabbing my cleansing swab and I would break it. I'm contaminating with this hand. And lifting these up, and I'm going to hold this over the insertion site for 30 seconds. So I've held that for 30 seconds, and now I'm going to begin cleaning around the area. So I'm starting at the top, and I'm going to do back and forth motions. And I'm making sure not to go back over the insertion site. So I did that for 30 seconds, now I'm going on the side. Now the other side.
It does not have a transparent dressing in here, so I'm going to call
And then on the bottom.
a nurse for a new sterile. So I'm going to open that.
Okay, and I've done all that for 30 seconds. I'm still holding the tube, and I would dispose of this in the trash. Then I'm still using my sterile hand, and I'm going to grab my BioPath.
Okay, so this is the new sterile kit.
And drop this on around the insertion site. Okay, and make sure that sticks down. I'm still not touching the side.
One has the dressing. So I'm going to leave
Okay,
this.
and then I'm going to take my transparent dressing and drop it over the insertion site. For now, I'm going to let this go. This hand is still contaminated, so I'm going to drop it.
So now I'm going to clean the site.
Let it fall.
Put my napkin in the pan.
Not touching with this hand.
Dressing here, the line, and I'm going to push this and report exiting, and I'm going to get it on the side for a second, so it saturate. And then I'm going to start the top bottom, and I'm going to cover it.
So now the transparent dressing is secure, so my gloves can touch and get this stuff down now that the insertion site is not exposed.
Over the line. I'm doing this for 30 seconds. And now I'm going to clean the line. I'm going to exiting, and I'm going 6 feet up. 6 inches up, sorry. Okay, and that is done. And now I'm going to throw that in the trash. And I'm going to,
Okay, and I have taken this.
so I'm going to next time for exiting, we would do this for health policies that have been provided.
And then I would take my label, which would have the date, time, and my initials, and I'm going to place that without covering up the insertion site.
Okay, and then I would let this dry for a minute.
Okay,
And then
then
would
I can remove my gloves
sterile dressing
and my mask,
over the site.
remove my patient's mask. Then I would anchor the tubing to the chest, making sure that it's also not covering the insertion site. So I've done that, and then I can go ahead and cover my
Doing
patient
that,
up
and I'm making sure that all the air is out of it.
and raise them back up to a comfortable position, and lower the bed all the way back down.
And this is not sterile.
And then I would clean up all my supplies, make sure that the side rails were raised, and then I would document appropriately and check back in on my patient, making sure that they're having no issues with their new dressing. That is it.